And now we'll hear from Kathy Ford, President and Chief Product Officer of Rhinogram. Kathy, the floor is yours.
Thank you, Adam. I am so excited to be here today with you and to be talking about this really important topic of telehealth, virtual care, and access for all. As we get started, I would really like to take a couple minutes and just relay some of the recent findings and learnings that I've collected over these last many months, certainly in these COVID times, and what we're looking at as far as and hearing as far as thinking about virtual care and providing access to the entire population. So with that, let's take a look at a couple data points. So we all know that healthcare has had many challenges pre-COVID, and many of these that we see up here existed for many years prior to this pandemic that came upon us in early 2020. But really looking at what we knew before and what's now been elevated, it has put new challenges in front of us that we've got to contend with. We know that the portal has not been adopted the way it was expected to years ago. And so what that means is we've got to find a different way to stay connected to our patients, especially in these times when frequent connection and engagement is really necessary. And then when you also look at the fact that we've got people without access to broadband, a new challenge is upon us. We also heard and are aware of so many of the practices that had to close. Certain specialties were required to. Others needed to just from a financial perspective, some of which we know will not reopen, which of course presents another set of challenges as far as shortages and burnout. For those practices that did stay open, we also know that patients were and are afraid to go see their doctor. They're afraid to get sick. They don't want to be at risk. And so patients are canceling and not showing up, which presents huge problems, which we already knew about before COVID. Managing the patient call volume, which has exponentially increased with the recommendations from the CDC from the beginning of this situation, recommending that patients call before they come in, or certainly don't go to the emergency department if you absolutely don't need to. How are these practices prepared to deal with this extreme call volume, essentially overnight? We know we have a large population of patients that are managing chronic conditions, many of which have multiple chronic conditions. So what do we have in place that's going to help these provider organizations, clinical teams stay engaged with these patients, make sure they're adhering to their care plans? This is a challenge that we've got to figure out how to close this gap. Communicating with our staff, our care teams are managing so many different elements as it relates to their patients. And when we look at a virtualized setting, which means nobody could be in a practice, everybody could be providing care from remote locations. So how will staff stay connected, stay informed, stay aware of all of the new standards and protocols and practices that are being put in place, especially around sanitation? And then lastly, from this particular focus point, we have been so accustomed to working around the brick and mortar of a patient care setting. And when suddenly everything shut down in our country, we realized that we have been overly reliant on things that we could really mainly only access if we were in that physical building. We have to look at it differently today. And going forward, we have to have a way to access patient information, to stay connected with our patients, stay connected with our staff, stay connected with our other care team members and referral organizations. All of this has to be virtualized. I wanted to take a couple minutes and just share a snapshot of what I've been looking at as far as the service lines or the specialty areas that are really leveraging telehealth. And what has been pretty consistent really over the summer months, which is also not too surprising here, is really the topic of behavioral health. So psychiatry, neurology, and this is just a view from one period of time in the summer. But what we are seeing is behavioral health needs on the rise, and it's not terribly a huge surprise. I think we're also really becoming aware of the effects of, from a financial perspective, people losing their jobs, people being sequestered or spending a large amount of times at home and by themselves. It's no wonder that behavioral health issues are being elevated here. So it's something that we need to put way more focus around and make sure that we're not losing sight of this population that is at risk. I've also found it interesting to understand, with the instant adoption of telehealth that took place, which of course, for all of us who have spent decades in healthcare, we can all agree that what happened over a period of months as far as adopting a new technology approach to care has simply never happened in our industry. Typically, technology adoption in healthcare can take years for full adoption. Understandably, we're a very risk-adverse industry. However, it was a time of crisis, certainly. We're still not through it. So I found it interesting when I went to go understand, is it only COVID that is being used, where telehealth is being leveraged? And to my delight and surprise, it isn't. And not only for, of course, COVID cases, but for non-COVID urgent issues, for regular screening, everyday care. You can see on these different graphs and charts that it became clear that the approach of virtual care could be leveraged beyond just COVID. And to further support that, we have learned from CMS that they're anticipating 20% or greater for all visits to be virtualized, for 20 to 30% of visits to be virtualized in 2021. And we're seeing CMS also quickly adjust fee schedules, physician fee schedules. We've got some additional ones that are out for comment right now and expect to be put into place before the end of the year, of course. So this is all very, very encouraging, but it's also now putting a new challenge in place as far as what do we need to be thinking about as this is our new go forward and new de facto of care for a lot of purposes. We've also been spending a lot of time with our organizations thinking through and looking at the entire care delivery spectrum and what those different delivery models look like and care models, and where does virtual fit as far as, so it's not just a COVID situation. And then thinking about, what sort of capabilities are needed to support these care models across the spectrum here, and how prepared, what do we have in place today, what do we need to be looking for, and some other considerations as it is. This is certainly not all of the capabilities, but as I've been spending great amounts of time with our client base and other terrific thought leaders in the market, this has been pretty consistent as far as where other healthcare executives are thinking as it relates to most important elements to deliver care. And then last but not least, we always want to be thinking about everything from the patient's perspective, patient centricity. Even pre-COVID, we know that consumerism was coming into healthcare with full force, and COVID really sort of pushed that even across the line here. So when thinking about care and virtual care, it's not just the clinical visit, it's actually the entire journey. And that's what we need to be thinking about as it relates to how do we touch all the patients we possibly can? How do we deliver the best care in the most comprehensive way? And we all know that the entire patient journey, only a small part of it actually is the clinical encounter element. In order to even get there, so much has to happen before. And in order for it to be meaningful, so much has to happen after it. And so with that, I'm really excited to dive into it more so with you, Adam.
Excellent. Well, thank you so much. So you talked a lot about connectivity. How can providers ensure that underserved patients have equitable access to care, especially for urban and rural communities where connectivity or access to internet or computer may be an issue?
It's unfortunate that even in these times and in our great country, about 30% of Americans don't have access to broadband. However, what we do know is that 99% of all Americans have a phone of some kind, and about 92%, depending on which age group you're in, actually have smartphones as well. Between 18 and 49 actually is in the high 90s. And so with that, what that means is we need to go to technology that is already in the hands of patients. And what I mean by that is texting. I mean, first and foremost, as the first point I made about the portal has a purpose. But when it comes to initially touching a patient, making sure that you have regular contact with a patient, you cannot assume that that's, especially at 10% average adoption. So texting has to be a primary piece of technology that every delivery organization has in their arsenal in order to stay connected with their patients.
Excellent. So what about behavioral health? You talked about it a little bit, but how should providers address this crisis around behavioral health in the virtual space, and how do they serve these tremendous needs that we know exist?
I think it's a couple different ways. So we have to start with, again, a different technology approach, especially thinking about behavioral health, where a lot of that therapy is conversational. And so what is the most accepted form of conversation today? It's, where do people live? They live on text. And so it, again, has to start there. I would also tell you that we need to bring care to social media, and because that's also where people live today, whether we like it or not. And so just believing that, if we build it, they will come is sort of the wrong way to think about it. And behavioral health, when you think about the population that's at risk right now, it's, our 18 to 49-year-olds who, again, are all texting. We need to give them that, initial anonymity, that convenience, the fact that they don't have to download anything new or learn something new in order to get some access. Not to mention, again, we have extreme deficiencies and deficits as it relates to behavioral health specialists across the country, but predominantly in rural health communities. So therefore, the only way to bridge that gap for right now is to leverage technology so that people have access to healthcare professionals, essentially wherever those professionals may be, whether they're at home, on vacation, down the street, at a facility, driving in their car. We have to use technology to bridge that gap.
Great. Well, thank you, Kathy.